In this section, we will show you how to collect and store your bowel movements safely and hygienically for medical research. This is an important step to ensure the quality and validity of your samples. First, you will need a clean container with a lid, such as a plastic bag, a jar, or a box. You can use any container that is large enough to hold your bowel movements and can be sealed tightly. Make sure the container is labeled with your name, date, and time of collection. Next, you will need to prepare your toilet. You can either use a disposable bedpan or a plastic wrap to cover the toilet bowl. This will prevent your bowel movements from mixing with water and other substances. Alternatively, you can use a regular toilet and scoop out your bowel movements with a clean spatula or spoon. Then, you will need to defecate into the container or the toilet. Try to avoid urinating at the same time, as this can dilute your sample. If you do urinate, you can use a separate container to collect it. You should also avoid using any toilet paper, wipes, or other products that may contaminate your sample. After you have finished defecating, you will need to seal the container tightly and store it in a cool and dark place. You can use a refrigerator or a cooler with ice packs to keep your sample fresh. Do not freeze your sample, as this can damage its structure and composition. Finally, you will need to deliver your sample to the medical research facility as soon as possible. You can either bring it yourself or use a courier service that specializes in transporting biological specimens. Make sure you follow the instructions and guidelines provided by the facility on how to pack and label your sample. By following these steps, you will be able to collect and store your bowel movements safely and hygienically for medical research. This will help the researchers to analyze your sample and gain valuable insights into your health and well-being. In this section, we will show you how to use a photocopier or scanner to create digital images of your bowel movements. This is an important step for medical research, as it can help doctors and scientists to analyze your digestive health and diagnose any problems. To use a photocopier or scanner, you will need the following items: a clean container to collect your stool sample, a plastic bag or wrap to cover the container, a pair of gloves to handle the sample, a photocopier or scanner that is connected to your computer, a software program that can scan and save images, such as HP Scan or Windows Scan. The steps are as follows. Collect your stool sample in the container. Make sure to fill it at least halfway, but not too much that it overflows. You may need to do this several times until you have enough samples for your research. Cover the container with a plastic bag or wrap. This will prevent any odor or leakage from the sample. Put on the gloves and carry the container to the photocopier or scanner. Be careful not to spill or drop the sample. Place the container on the scanner glass or in the feeder tray, depending on your device. Make sure that the sample is visible and centered on the scanning area. Open the scanning software on your computer and choose the settings that suit your project. For example, you may want to scan as a PDF or JPEG file. Select color or black and white mode and adjust the resolution or size of the image. Click Scan and wait for the preview to appear on your computer screen. You can edit the image by cropping, rotating, or adjusting the brightness if needed. Click Save and choose a name and location for your image file. You can also choose to send it by email or upload it to a cloud service if you want to share it with others. Repeat steps 4 to 7 for each sample that you want to scan. You can scan multiple samples in one file or create separate files for each one. When you are done scanning, remove the container from the scanner and dispose of it properly. You can also clean the scanner glass or tray with a damp cloth if there are any stains or residues from the sample. Remove the gloves and wash your hands thoroughly with soap and water. Congratulations! You have successfully created digital images of your bowel movements for medical research. You can now use these images for further analysis or comparison with other samples.